Hello, my name is Vicky Kiesel. I'm a registered genetic counsellor and I'm here to answer some of the common questions about genetic testing. BowelGene, what do we test for? BowelGene is a genetic test which analyses the DNA code for 12 different genes. These genes have been shown to cause an increased risk of bowel cancer and associated cancers. Genes for Lynch syndrome and various polyposis syndromes are included in the test. What are genes? Genes are the body's instructions and determine how the body develops and is maintained. Some genes prevent cancer developing, so if there's a mutation in one of these cancer genes, then the gene doesn't work correctly and this causes an increased risk of cancer. Why would I want a genetic test? Genetic testing can help to determine your risk of bowel and associated cancers. If you do have an increased risk, then there are several things we can do to lower your risks or to find a cancer early should it develop. Some of these options include risk-reducing surgery, medication, and increased screening such as colonoscopy. Colonoscopy is particularly helpful because it lowers the risk of bowel cancer by removing growths known as polyps before they become cancerous. Why is genetic counselling important? Genetic counselling assesses a client's family history and provides a risk assessment. The genetic counsellor also explains exactly what the test includes and the implications of testing, including the risk of cancer and the necessary cancer screening. How does the test work and how long do the results take? The test is performed on a blood sample and the results will be available approximately 8 weeks after you have your blood taken. An appointment will be made with the genetic counsellor who will explain the results and recommend appropriate cancer screening. The test uses state-of-the-art technology known as new generation sequencing to examine the code for each of the 12 genes in detail. In addition, further analysis is used to look for large missing or extra parts of selected genes. Who should be tested? People at risk of hereditary bowel cancer may wish to consider genetic testing, and where possible, it is always more informative to test someone who has had bowel cancer themselves. The majority of bowel cancer occurs by chance, however 2 to 5% of bowel cancer is inherited. Families with hereditary bowel cancer generally have several relatives with bowel cancer, often diagnosed at younger ages, or individuals with multiple bowel polyps. A genetic counsellor can assess your family history and tell you what your personal risk is. What does this mean for my family members? If a genetic mutation is found in the family, it is possible to offer genetic testing to other relatives to help determine their risk of cancer and recommend appropriate screening. When someone has a gene mutation, there is a 50% chance that they will pass it on to their children. What can I do to lower my risk of bowel cancer? There are several things you can do to lower your risk of bowel cancer. A healthy diet lowers the risk, as does physical activity. It is also important to limit your intake of alcohol and not to smoke, as well as to maintain a normal body weight. How do I book an appointment to discuss the test, and do I need a GP referral? Please call 0800 074 5888 to book an appointment with a genetic counsellor to discuss the test. You do not usually require a GP referral. Initially, you will be sent a family history questionnaire, which will be analysed, and then an appointment will be scheduled for you with the genetic counsellor at a mutually convenient time and date. Following your consultation, if you decide to have testing, you will be sent a genetic testing kit and asked to have your blood taken at one of our convenient blood drawing centres.